Hi there, Dr. Gary here on the road. We sell dental practices nationwide. Today's topic is, what's the highest price paid for a patient record sale or chart sale of a dental office? Let's discuss that today. Right now, we are in 28 states selling dental practices on a nationwide basis. We've been doing this, and we have 10 employees, including 2 CPA accountants. We've been doing this for 13 years now. I was a dentist for 25. And we think we have valuable information to share with you. Even if you just want to chat, or you want to consult, or you want an appraisal, sell your dental practice, we can help you buy, sell, whatever it is. Now, the information you're about to hear is for entertainment purposes only. It's not legal or business advice. So that's important you understand that. If you're thinking about selling to one of the larger DSO groups, call us, because we work with them all, and we know who's going through what changes right now. There are some changes going through, some consolidation and such. So we know who to steer you to. That will perform best for you. So give us a call on that. We could talk about it. Now, generally, when we work with the DSO groups, they will pay our commission, a case-by-case basis. But generally, we get the commission paid, so there's no commission to the buyer. If we engage the services, and we engage our services by the buyer, well, the buyer historically will put a little bit of marketing, advertising, will not be paying a commission. Will give us a little tip, let's call it. We do have a retainer fee we charge, but that is refundable if the deal doesn't close. And all of our deals appear to be going to closing now. So let's talk about, and once again, we're available from 8 a.m. to 9 p.m., 201-663-0935. Let's talk about, the doctor has a situation where they want to sell patient records. Now, historically, these go from the lowest I've sold them was about 19% of 1 year's gross. And the highest I sold them was, I believe that was 52%. That's quite a difference there. But the offices I sold them to at the high dollar amount were very organized offices, were able to make room for the new patients and bring the doctor along to work a little while. Most of the doctors that paid high dollar wants the doctor to stay on a little bit, at least 6 months. That's one of the keys to success. On the other hand, we sold that practice, if you remember, it was about 19 cents on the dollar, and we sold it. That did very well. The doctor couldn't practice anymore during COVID and so forth, so he bought it at 19 cents on the dollar. Doctor wanted his money up front and didn't want to wait. So the variation goes from the lowest I've sold is 19%. The highest I've sold is 55%. Now, that's not the norm for record sales. They usually sell for more money. But it's an opportunity for you to look at that and use it as a comparison. Now, if a doctor really wants a practice, he's going to go out of his way. You're going to know within 48 hours if he wants it or not. He'll go out of his way to get it. And the fact that it's somewhat absentee and they're not doing as much marketing could be the fact that they're doing well enough, that they're getting enough fee-for-service patients. So all of this plays a role. Excuse me, my glasses on here. All of this plays a role in the final acquisition of the dental practice. So it will vary from state to state, but I just left New York City, and the buyer is willing to pay 55%. Of course, it's dependent that, hopefully the patients show up and the buyer is going to work for just a short while just to get acclimated. And I think it could work out quite well for both the buyer and the seller. The buyer is getting top dollar. And these are practices worth like $300,000-400,000. Buyers getting top dollar. So they're happy. The seller's happy with the top dollar. The buyer is going to be happy with getting new patients in the chair. And then work his or her magic on convincing them to do needed dentistry and then any cosmetics. All right? So just some tops and points for you there. We'll see you on the next video. Keep watching them. Thank you. Bye.